What is up? My name is Austin Marks and welcome to my YouTube channel. So on my YouTube channel I talk about respiratory therapy, talk about respiratory therapy school, and talk about what it's like being a respiratory therapist. So if you want to see any of that, make sure you check out my channel. I am also the admin of a Facebook group called the RT Club, and on this Facebook group it's full of respiratory therapists, respiratory therapy students, and anyone looking to aspire respiratory therapy. It's where we can kind of all bounce ideas off each other or ask questions about certain patients or certain things that's going on in the respiratory world. So if you want to be part of this community, make sure you go check it out. Once again, it's the RT Club. So in today's video, I'm going to be talking about ABGs, or also known as arterial blood gases. So what is an ABG? An ABG is when we draw arterial blood and then we run it through some kind of machine and then it lets us look at the blood chemistry. So the blood chemistry that we can look at from a blood gas or an arterial blood gas would be the pH of the blood. We can look at the CO2 level within the blood, the bicarb level within the blood, the pressure of oxygen within the blood, as well as the base excess. So this basically just gives us an overall acid-base balance of what exactly is going on with our patient. So if the person is very acidic, either because the bicarb is a certain level or because the CO2 is a certain level, this will tell us exactly what's going on with the patient and what we may need to do in order to fix it. Same goes with if the person is very alkalytic. If their pH is above 7.45, something's going on. So what is exactly going on? We need to look at all the factors that's going on just so we can determine what we want to do with this patient and how we want to get them better. So why would we need an ABG? Why would the doctors order one, or why would we tell the doctors that we think the patient needs an ABG done? So maybe the patient is going into cardiac failure, liver failure, or even renal failure. Maybe there's some kind of hyperglycemic things going on and just the metabolism within the body is not set correctly. Maybe the patient's going into respiratory failure, multi-organ failure, maybe the patient has sepsis, maybe they have pretty severe burns, maybe there's tons of toxins within the body, if the patient took a lot of drugs. There's so many different reasons why we would need an ABG, and a lot of times you're going to notice in the ED, a lot of physicians will go, okay, we need an ABG, we need a CBC, we need to know all this stuff. So we can do it down in the ED as well as the ICU on the floors. Really anyone can have an ABG done as long as there's some kind of indication that it needs done. So for an adult patient, the three primary places that you'd go ahead and get an ABG would be one of the radial arteries, doesn't matter which hand as long as there's no limular or anything else that would advise against going with that arm. You can get it from the brachial artery, or you can either get it from the femoral artery. So that would be down in your legs, near your femur obviously. So I've never gotten an ABG done on me. However, when I do it to patients, it does not look fun. It does not look like it tickles at all. It's much more painful than getting like an IV stick, or if lab comes in, they're drawing blood to get all that stuff done. It's definitely a lot more difficult. It's definitely a lot more painful just because the arteries are much deeper. I don't want to say much deeper, but they are deeper than the veins. And then you also have the nerve running alongside the artery at the radial spot. So therefore, if you hit that nerve or anything like that, it's gonna hurt. So like I said earlier, the things that we can get from an ABG include the pH, the CO2, the bicarb, the oxygen, the base excess, and we can even look at the saturation of all the hemoglobin within the person. So I want to start off by just telling you normal values, because you have to know normal values. And if you ever look at an ABG, all you get to know is normal values. And if it's not in the normal range, then obviously this ABG is not normal. So let's look at pH first. The average, not the average, but the normal pH is 7.35 to 7.45. For the CO2 level, it's 35 to 45. You look at the oxygen, it should be anywhere from 80 to 100. Now it can be above 100 and it can be below 80. So this is the pressure of oxygen within your body. So then we also want to look at the bicarb. So the bicarb should be anywhere from 22 to 28. And then we also want to look at the base excess. So this should be anywhere from -2 to a +2. And then with oxygen saturation, we want this to be above 88%. So I want you to write these numbers down. I want you to memorize them, because as respiratory therapists, this is the bread and butter right here. You need to know these numbers. And then anytime you look at an ABG, if it's not normal, it's not normal. And that's how I want you to start studying ABGs. So I want you to just look at ABGs and be like, okay, that's normal, not normal, normal, not normal. Don't focus on anything right now, just be able to tell if the pH is within the normal range, if the CO2 is within the normal range. This will kind of help you memorize the numbers a little sooner. So the first thing that I absolutely look at every single time is the pH. So this is the main thing I look at to tell me if it's normal or not normal first. So look at this here. So you can see the pH is 7.40, which is perfect, right in the middle. Then you say, okay, pH is great, that's awesome. And then look at everything else. Okay, CO2 is great, oxygen is great, bicarb is great, base excess is great, and the oxygen is great. So this ABG is normal, so we're good. Now I want you to look at this one here. So right away, look at that pH. pH is not normal, so okay, something else has to be not normal. So we look at the CO2. Oh, right there, that's out of range. The oxygen level, oh, that's pretty good. Bicarb, that looks good to me. Base excess, looks normal. Oxygen, once again, looks normal. So once again, we can see the pH is not normal, so therefore this ABG is not normal. And what's causing it to not be normal? The CO2, because the CO2 is also not normal. So right now you don't need to know why, what is doing what. Just realize pH is not normal and the CO2 is not normal. So therefore the CO2 is making sure that the pH is not normal. So I'll talk about how the CO2 is making the pH not normal. The two things that will affect the pH is the CO2 as well as the bicarb. So let's stay focused on pH right now, but let's take a little bit of a deeper dive. So if we look at this, the regular pH scale, we know that anything below 7.35 is going to be acidic. Anything above 7.45 is going to be alkalytic. And like I said, the two things affecting the pH are the CO2 and bicarb. So let's just focus on those three things right now. We're just going to look at pH, CO2, and bicarb. So let's start out with just one at a time. So let's start out with CO2 and pH. So let's look at this one here. So this is the same one from earlier. You can see that the pH is not in normal range and the CO2 is not in normal range. So now I just want you to focus on the CO2 here and how it affects the pH. So if the CO2 increases, this will make the pH go down because CO2 is acidic. So if we have more CO2, the pH is going to be more acidic. So if you look at this one, once again, the pH is 7.30 and the CO2 is 48. So therefore we have more CO2 than we need, so therefore it's going to make the pH more acidic. So remember that, more CO2, more acidic. This is the exact same for the opposite. So let's say we have less CO2. Let's look at this one here. We see the pH is 7.48 and our CO2 is 30. So our CO2 is on the lower end, so therefore our pH is going to be a little bit alkalytic. So therefore CO2 is lower, pH alkalytic. So just kind of remember that with the CO2. When the CO2 is higher, that's more acidic. When the CO2 is lower, that's more alkalytic. So what does that do to our pH? So high CO2 will make the pH go down, and a low CO2 will make the pH go up. So right now, just focus on some different ones. Just write them down yourself. So okay, so if I have a CO2 of 100, what's that going to do to the pH? So I'm probably going to have a pH of 7.19 or something like that. It's going to bring it way down. So just think, high CO2, low pH. Low CO2, high pH. So I'm not going to go over all the reasons as to why a person may have high CO2. I'm going to say that for a different video. For this video only, I only want you to be able to interpret ABGs. So I don't want to confuse you guys too much, but now I want to jump into bicarb and pH. So let's just focus on bicarb and pH. So make sure you run through a lot of scenarios where you go through just CO2 and pH, and then I want you to do the same exact thing for bicarb and pH. So once again, what are my normal ranges? pH, 7.35, 7.405. And then for bicarb, 22 to 28. So let's look at this one here. As you can see, the pH is 7.48 and the bicarb is 30. So our pH is on the higher end, but also our bicarb is on the higher end. So the bicarb is the base and the CO2 is the acid. So right now we're just focused on bicarb and pH. Bicarb and pH. So the bicarb is the base, so we have more of the base. What is that going to do to the pH? It's going to make it more alkalytic. So therefore, Let's look at this one here. We can see that our bicarb is 18 and then our pH is 30. So we have less of that base, we have less bicarb. So what's that going to do to our pH? It's going to bring it down. So like I said, I want you to focus on a few scenarios. Just run it by, just write some down yourself, just kind of make them up as you go, with just focusing on pH and bicarb, pH and bicarb. Do the same thing for the pH and CO2, pH and CO2. If I have a high CO2, what is that doing to my pH? If I have a high bicarb, what is that doing to my pH? You have to understand that before you can dive a little You have to understand that before we can dive just a little bit deeper. So once you understand how to figure out the pH by just looking at the CO2 and bicarb individually, we want to go ahead and mix those two concepts together. And if you have mastered them individually, this should not be that difficult. So let's look at this one here. Our pH is 7.30, our CO2 is 48, and our bicarb is 22. So, okay, we know our pH is out of whack, but what is causing it to be out of whack? Is it the CO2 or the bicarb? So which one is not normal? So CO2 obviously is not normal. So what is happening? We have a bunch of CO2, which is more acidic, which is going to do what to the pH? Bring it down. So I think this is the perfect time to talk about this here. So we can see that our pH is out of whack, and then our CO2 is out of whack. So a CO2 is respiratory and the bicarb is metabolic. So therefore, if the CO2 is out of whack, that means we have a respiratory problem. If the bicarb is out of whack, we have a metabolic problem. And I want you to remember those terms with those exact things as well. So CO2, respiratory. Bicarb, metabolic. So we look at this one again. So CO2 is out of whack. So therefore, it's a respiratory problem. So this one here is going to be a little bit of a tougher one. So let's look at this here. So we see the pH is 7.25. The CO2 is 44 and the bicarb is 18. So okay, now all of these are out of whack. Well, what the heck is going on here? So we know our pH is not normal. So therefore this is not normal at all. Okay, so let's look at our CO2. Our CO2 is high. So what is that going to do to our pH? It's going to bring it down, make it more acidic. Okay, so that makes sense, that part there. But our bicarb isn't right, so let's look at this as well. Oh, well, our bicarb is low as well, so they're both causing it to be acidic. So they're both going to bring the pH down. So if you look at this would be a mixed respiratory and metabolic acidosis. Why is it mixed? It's mixed because the respiratory, or the CO2, is not normal, and the metabolic, or the bicarb, is not normal. Both being in the acidic level, bringing the pH to be more acidic and bring it down. So therefore it's a mixed acidosis. So once again, going back to exactly what you did when you had just the pH and CO2, or just the pH and bicarb, run through a couple of these with just the pH, the bicarb, and the CO2. So now a website that I absolutely love is a website called ABG Ninja, and it primarily just focuses on these three things, and it kind of lets you figure out if it's just a respiratory acidosis, if it's a respiratory alkalosis, metabolic acidosis, metabolic alkalosis, or if it's mixed. Kind of goes over all of that. Now with this website, it does also want you to take into consideration if it's compensated or non-compensated. So we're going to talk about that here in a little bit, but right now, just remember that website, ABG Ninja, and I highly, highly recommend that you go on that website and just practice, because that's how you're going to understand ABGs. Is you just got to look at it time and time again and practice. So I said that we were going to talk about compensated ABGs, and that's exactly what we're going to do. So now this gets a little bit more complicated here. So remember I told you to always look at the pH first? Well, look at this one here. We can see the pH is in normal range, so this must be in normal ABG, right? Wrong, because we want to look at everything else that's going on as well. So we look at the CO2 and we're like, that's not normal range. Look at the bicarb, and it's not normal range either. So what the heck is going on? So when something is compensated, this means that the CO2, for example, in this one, is causing the pH to go down, but then the bicarb is compensating for that. So therefore it's at a higher value than it should be to kind of bring that pH back up into the normal range. So the bicarb is basically compensating for that high CO2. So we look at this one here and we say, okay, the pH is normal range, but once again, CO2 is out of whack, bicarb is out of whack. But we can also look at the pH and see that it's on the lower end. So therefore, it's going to be a little bit more acidic, but it's normal. So what is really causing that to be more acidic? It's that CO2 level. So with that high CO2 level, that's causing that pH to come down a little bit, and the bicarb is going to be on the higher end, which is going to bring it back up, and that's going to make it be at that normal range. So like I said, this is probably the most confusing thing here. If you didn't understand what I was saying, leave a comment, maybe I can type it out better in words or whatever. However, if you went to ABG Ninja and you had to kind of look at this exact ABG and say exactly what was going on, this here would be a compensated respiratory acidosis. So it can't be compensated unless the pH is in a normal range. So let me say that again. It cannot be compensated, it cannot be totally compensated unless the pH is in a normal range. So let's kind of switch this up here and look at this ABG here. So now this ABG would only be considered partially compensated. Why is it only considered partially compensated? Because it's doing the exact same thing that the last ABG was doing. Well, it's because the ABG is not in that normal range. So if it was in the normal range, that means it'd be totally compensated. That means that the bicarb would totally be compensating for the CO2. However, it's only partially compensating for it. I hope that makes sense. One thing I want you to take into consideration with every ABG is it normal or not normal? Think about every single value and think normal or not normal. Also, stay focused on those three things first. The pH, the bicarb, and the CO2. Notice that's the only things that I've been teaching you right now. So I know that I've probably confused the crap out of all of you. However, let's take a few. Let's look at a few examples here. So once again, let's look at the pH first. Okay, not normal. Let's look at the CO2. It looks out of whack. Okay. Let's look at the bicarb next. Okay, that's normal range. So the two things that are out of whack here are the pH and the CO2. So what is the CO2 doing to the pH? So we can see that the CO2 is on the lower end, which is going to bring the pH up. So we have less acid, it's going to bring the pH up, make it more alkalytic. Let's look at another one here. Okay, pH looks perfect, right on the dot. That CO2 looks pretty high, and that bicarb looks pretty high. So what the heck is going on here? So pH is normal. CO2 would really drop the pH. That doesn't make much sense. But then we look at that bicarb, and that bicarb would bring it back up. So once again, we see that the CO2 would bring the pH way down low, but then the bicarb is high, which is alkalytic, which brings us back up into that safe zone, which is right on the money. So this is probably where this person lives, honestly. So this is probably like an extreme COPD, or someone who has it very badly and their body just got so compensated, fully compensated, that they just live at a very high CO2. And I have seen CO2s where people lived and they're almost in mid-70s. Now 89 is a bit high, but hey, I'm just making up some different ABGs here. So how about this one here? We can see the pH is obviously low, CO2 is very high, bicarb is normal. So we can see what that CO2 is doing. We can see that the CO2 is dropping that pH really low. So when the CO2 is high, it's going to bring the pH very low. And then the bicarb is not doing anything, it's kind of just where it's supposed to be. So I apologize I didn't talk about this for the last few, however this one here would just be a respiratory acidosis. Okay, pH looks good, CO2 looks good, bicarb looks good. We got normal ABG. Alright, let's try another. Okay, the CO2 is low. Okay, the pH is low, CO2 is low, and bicarb is low. So, okay, let's look at what a CO2 of that would make the pH do. So a CO2 of 20 would make the pH go up, right? But then, so we should have an alkalytic pH, right? Except for you look at the bicarb, and the bicarb is very, very acidic, which brings it way down past our normal value, which kind of is the reason why our pH is so low. So if you look at this one, it's a partially compensated metabolic acidosis. So why is it partially compensated metabolic acidosis? So the bicarb, which is metabolic, is bringing the pH way down. So if just the bicarb was just that low, it would probably be like 7.10. However, the CO2 kind of brings us back up a little bit here. So therefore, it's trying to compensate, but it's not compensated enough to bring us back up to our normal value. So therefore, it's only partially compensated. I hope that makes sense. So once again, I highly recommend you head over to abgninja.com and just practice every single day. Just practice. Even if you can only do like 5 at a time, whatever, just do them before bed, because that's the only way you're going to learn it. That's the only way you're going to master ABGs. I know for my respiratory class, I had to get 100% on my ABG test. When I graduated, I had to know them like the back of my hand. So like I said before, just focus on pH, CO2, and bicarb. So I've repeated several things in this video, and why have I done that? Because those things are important. So I do want to focus on some of the other stuff now. So let's look at the base excess. The base excess is basically a buffer system. It's all the other little chemicals that would kind of compensate for the pH as well. However, they don't have as an extreme effect as the CO2 and bicarb. So therefore, the base excess looks at everything else as a whole compared to just one or two things. So the PaO2 is the partial pressure of oxygen within the blood. So this is different than the SaO2. So the SaO2 is the amount of, or percentage of hemoglobin that is saturated with oxygen. Now, that can only get to 100%. All your hemoglobin can only get to 100%. But your PaO2 or your pressure, I've seen it all the way up to 400. And that's because someone like me who doesn't need oxygen would be put on a non-breather mask and just have tons of oxygen put in. So therefore there's a lot of oxygen in my blood that's not needed. So yes, all my hemoglobin have the oxygen, so my sats are going to be 100%. But then there's a lot more oxygen particles just kind of floating around in there. So that's what would make that high. So if it is 400, obviously take me off some of the oxygen and kind of bring me back down to like 100. If it's extremely low, put some oxygen on me because my sats are probably not that high either. So for a healthy individual, you want the partial pressure of oxygen to be anywhere from 80 to 100. Anything less than that is abnormal. Anything above that is abnormal. I mean, it's okay to be a little abnormal, however, you don't want it to be too high. Now some people who have certain diseases such as COPD, they may live at a PaO2 of 78, 79, which is below what it would be for me. Like, that'd be terrible for me. However, for them, that's the normal. That's just where they live. So that's why it's great to understand your patients. You want to know them, understand all these different disease processes and exactly what's going on with them. So I am going to make another video talking about the ABGs once again and looking at them and okay, so let's say I have this ABG for a patient that comes into the ED, or let's say I have this patient who has this ABG on a ventilator or a BiPAP machine. What do I want to do? How am I going to fix the problem? This video was mainly about just how to interpret the ABGs, how to look at it and say, oh, well, that's what's going on. It's either a respiratory problem or it's a metabolic problem or it's both. So therefore, we need to fix it both ways. Just so you can get an understanding of what's going on, because you want to lay the foundation down before you start building blocks, and that's exactly what I'm doing. So make sure you just learn ABGs, you understand what you're looking at. Just, is it a respiratory problem? Is it a respiratory acidosis, is it a respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis? Is it a mix? Is it compensated at all, partially compensated? You want to know all that stuff. And like I said over and over again, go over to ABG Ninja, practice, practice, practice. And something I also did was I even made up ABGs for patients. So I would say, hey, I have this coming in to the ED. This is what their ABG looks like. What's going on? Or I just have an ABG here. What's going on? You should make ABGs for your friends and then have your friends solve it. And do the exact opposite. Just make sure that you're practicing, practicing, practicing. Well, anyway, if you have any questions, leave in the comments below. I hope you enjoyed this video. I hope I helped you learn ABGs a little bit. Well, anyway, see you in the next one. So I am going to make another video talking about the ABGs once again and looking at them and okay, so let's say I have this ABG for a patient that comes into the ED, or let's say I have this patient who has this ABG on a ventilator or a BiPAP machine. What do I want to do? How am I going to fix the problem? This video was mainly about just how to interpret the ABGs, how to look at it and say, oh, well, that's what's going on. It's either a respiratory problem or it's a metabolic problem or it's both. So therefore, we need to fix it both ways, just so you can get an understanding of what's going on, because you want to lay the foundation down before you start building blocks, and that's exactly what I'm doing. So make sure you just learn ABGs, you understand what you're looking at. Just, is it a respiratory problem? Is it a respiratory acidosis, is it a respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis? Is it a mix? Is it compensated at all, partially compensated? You want to know all that stuff. And like I said over and over again, go over to ABG Ninja, practice, practice, practice. And something I also did was I even made up ABGs for patients. So I would say, hey, I have this coming in to the ED. This is what their ABG looks like. What's going on? Or I just have an ABG here. What's going on? You should make ABGs for your friends and then have your friends solve it. And do the exact opposite. Just make sure that you're practicing, practicing, practicing. Well, anyway, if you have any questions, leave in the comments below. I hope you enjoyed this video. I hope I helped you learn ABGs a little bit. Well, anyway, see you in the next one.